alternative theories. I've seen other explanations for etiology that raise huge questions for us as a world community, and particularly for us as intellectuals. The one that most disturbs me, and I can only say I've read a lot of information that points to it as a possibility, is that this was and is an artificially engineered virus that was weaponized in some location we don't know. You know, people say that it was in the lab near Wuhan, which was actually created with French expertise from Lyon, just down the road from me. Or it could have been in some other lab. I don't care, you know, I don't know. I don't know enough about the technical identification of viruses to be able to comment on that. But I think as a philosopher and intellectual, specializing in peace studies, I think it's a hugely important question. And I would like anyone with the expertise in this group to address it.
I think Enrique Perez can address it perfectly well. Go ahead, Enrique, and use the opportunity to make your intervention and ask for.
Yes. Maybe I will do the clarification first, and then I go to this, which is quite interesting what you just raised, and it's about what Mike was saying. I think that I'm a little bit, not a little bit, I'm very optimistic about how these epidemics, how these pandemics is teaching the health systems to be resilient, and going towards universal health coverage, which is something that we need. I think that the systems and the countries are learning that they need to improve their accessibility to health services. They are learning that they need to have good critical infrastructure to address problems. They need leadership, and Costa Rica is a good example, a good Ministry of Health and a Minister of Health doing correct things and guiding the country. They need collaboration, and again, Costa Rica is a good example. It's not only the health sector, there are other sectors of the government involved in the response. Communication, I think the risk communication is something that they learn, they have to do it well. Improve the search capacity when they have to expand. How they have to spend and how fast they have to do it, they learn about that. The health, the workforce, our workforce enough? I think that they learn that they need how to have people that can enter when other healthcare workers get sick. And the medical supplies, the PPEs, the reagents, etc., the infection prevention control. In general, I think that all the health systems, and I think these public health measures in place are given the opportunity to the health systems in the countries to learn and to be more resilient in the future and to have a better universal health coverage. And I have examples of this, and Mike mentioned disasters. Yes, the Caribbean area is quite fragile in terms of hurricanes. And what they learned is to build what is called safe and green hospitals. So now they have hospitals that can resist the hurricanes and also are environmental friendly with the environment. So I think that we are human beings, we learn and we can adapt things, and I'm the big picture that Mike presented is correct. We need to do a change, but this pandemic is teaching us to do that. Telework will be a routine now. And the big companies were saying in every place, don't do telework. Now they learned that the telework is working. Telemedicine will be something that we will be doing. And this will be a standard in the future, which is not now. So I think that we are learning, and this is, and the multilateral cooperation as well. I think countries helping countries is something that we are learning. This is just to finish the part of the COVID and not distract too much the the discussion about the theology. Yes, we are concerned about the theology, and then working with the theology. We are doing whole genome sequencing. Several studies are being conducted, but by multi countries, looking for the potential divergency of the virus, if they can mutate very fast, how they mutate very fast, and of course how this virus were capable of being so effective in terms of human to human transmission. And this is quite related with the capacity of the virus to attach to receptors in the body, and this is in the genome of the body of the virus is in a specific part which is called the S part, which is the one that is very is very good, if I can put it that way, to give the virus the capacity to attach to the human cell and then colonize the human cell. This theory of the artificial engineering of the virus is because of that, because almost 98% of the virus is quite similar to a coronavirus in nature, and this 2% that we're talking about is exactly this S fragment, and the people were saying, well, and this S fragment is quite similar to the one in SARS. You remember SARS is another coronavirus, right? And the people were saying, well, they took it from SARS and they put it here, but we don't know that. This could be a speculation, and it could happen in nature as well, in the jump. In the interspecies jump and the adaptation of the virus to the human, they can change that. So I have no answer, actually. But your theory could be right, and somebody will prove it in the future, maybe, if they do the correct investigation, but also could happen naturally. Over.
Can I make one response to that?
Very short, Thomas. We're running out of time.
Sure. Okay. So thank you for saying that, and thank you for saying you don't know. That's the beginning of philosophical approach. I've discovered that if it were manufactured in a lab somewhere, we're guarded. The UN Bioweapons Convention gives the UN Security Council the authority to send an investigation team into any bioweapons lab on the planet. And I'm arguing that in order to clear this up, yes, it was, no, it wasn't engineered, we need to get the UN to send an inspection team into all the relevant labs. So if anyone wants more data on that, something I'm pursuing, it's through Geneva. Thank you.
Thank you. Vinay, you wanted to say something. Vinay Kumar from India.
Hi, Vinay Kumar here. Basically, India, our Prime Minister introduced some Ayush alternative therapy, and which is useful, and if everyone will follow, definitely it will help to cure or maybe prevention of the disease. So there are different type of therapy like yoga as well as naturotherapy. I'm using this basically water vaporizer, hot water. You can put little bit turmeric or eucalyptus oil. You can use even the salt, like because if you put a salt, then it is like a chlorinized air. You will vapor. You will that will clean your nose as well as the mouth and inside the lungs. So if you do every day like brush to brush, you can clean your lungs every day, like twice in a day. So it will help to prevent from this coronavirus. Secondly, we are distributing, this is a homeopathic medicine, that is arsenic album. A lot of people, they took for a prevention. This is a small dose. Then for sanitization, we have made this kind of UV portable lamp. So with ultraviolet rays, we can clean. This is a portable unit, so you can take anywhere, and whenever there is a patient or ambulance or hospitals, because we found a lot of hospitals, the health staff, specifically the paramedical staff, they are facing, due to the PPE shortage, they are facing a lot of problems, and they infected with this coronavirus. So it is very helpful to sanitize their whole system. Like, we can reuse the PPE gear, protecting gear, as well as the mask. So it is very economical, and so this is my suggestion to you. So if you like, then you can follow.
Thank you, Vinay.
Yeah, thank you.
Good. I have Vinay Kumar's contacts. We have 5 minutes remaining, and I know there are 2 more people that wanted to ask and make comments. I will give the word to them, but before, I want to actually bring us back on track, because we really haven't covered what we wanted to cover, which is regeneration, how regeneration fits in to work on community resilience during the COVID and post-COVID. And I don't think we'll be able to cover much in the 4 minutes we have left now, but then it's something that we still have to discuss further. And I'd like to be able to work on that. We have here the regular students from the certificate program on regenerative entrepreneurship, but we also have students from different master's programs in food safety. Actually, that was Enrique's baby. 20 years ago, Enrique? He was the author of that program. We have several students with us here, and we have external guests. I think I would like to, over the next 2 weeks, maybe, or 3 weeks, reprogram another session for those who want to, so we can discuss on the community resilience part, because I think that is vital. And maybe 2 weeks will be too far away, because we need to start working on it now. And we need to start developing strategies to give light at the end of the tunnel for political decisions. We see governments pretty much standing still, with either just not knowing when the economy is going to reopen, and kind of waiting for the elastic band to go stretching, hoping it won't pop very quickly. And other countries like the US saying that they're opening the economy in 2 weeks. Otherwise the damage is too big. And even some states saying that they prefer having the old people die than do the damage to the economy. So we have all of these different things, and the only thing I see possible, instead of arguing against many of these issues, is actually offering a way, offering a pathway that can be followed and is positive and gives hope. And I always say we've been taught that we have to adapt to a collapsing planet. We have to adapt to climate change. And I think that's the biggest lie, because what we have to do is create a better world. And we can co-create a better world without having to sit down and wait for the future to come and adapt to it. We can actually start working on the regeneration of the conditions. Mike was very clear, the carrying capacity of the earth. And it's not a question of people, number of people, it's a question of consumption of the people. It's not 7 billion, 7.5 billion, or 8 billion, or 15 billion, or what people are saying we have to reduce 15% of the population. I don't think it's a question of that. It's a question of how we are living. So I know Christoph wanted to say something. Please be very short and concise if it's a question.
Sure. Hi, and thank you very much. I've just been looking into the last couple of days. I've heard about a notion called, planet health, And so like with respect to more biodiversity, the increase in biodiversity leads to an overall increase in human health. Plus, I've also I've read a couple articles that suggest pollution levels are actually related to lethality in northern Italy and parts of the US. So would this be taken into consideration as we go forward? Because that definitely makes sense, especially as we're planning a new economy, whether we're going to be affected greatly by pollution, which a lot of people are now, especially.
I think it is very clear that we cannot go back to the model we had. And there's a lot of work on that. I'll pass it back to Mike in case you want to have a closing remark or proposal or whatever, how we move forward.
Well, I'm going to be very short, Edward, because I know you want to make sure everyone who has a question or comment can join in. What we're seeing around the planet right now during the pandemic is a massive collapse in atmospheric pollution and other forms of pollution being generated. So I think there's great hope that if we go toward a blue-green economy and vastly reduce petroleum and petrochemical pollution production, then the pollution will be reduced. We have a lot to remove from our environment from this Plasticine period where plastics are taking over the oceans and so on. But I think we still are at a place where if we could restart now and not go back into where we were, we have the chance to actually have a huge impact on the reduction of pollution and move toward more of a regenerative capacity within our ecosystems.
Thank you. Randall, you wanted to say something?
Hey, well, yeah, for one thing, as I understand that also part of the discussion should be to bring in initiatives or suggestions. Recently, I've started to take part into this project called SEEDS, which is kind of like a global co-op for using cryptocurrency to help finance like regenerative communities. So right now, people kind of start using the app and start earning this crypto. It's like getting started and building up like momentum. The intention is for users to receive like rewards and grants, which will come like in cryptocurrency for taking part of regenerating the planet pretty much, right? So you can be like an organization, or you can be just individuals making your part, helping to plant trees or helping building businesses with a more like a social and ecological mindset. And you can take part of using this cryptocurrency, and the system has its features
Randall.
to... Oh, shit. Hey, you lost me, really? Hello?
Okay, you're back.
I'm back. Okay. So yeah, the system's got like its own features and ways to incentivize people and receive more rewards the more that they contribute to the planet and to the community. So I just posted there on the chat. You can find out at joinseeds.com, or you can go to medium.com and search for Join Seeds, and you will see a lot of articles about the proposal.
Yeah, we're actually working with Seeds to launch the resilience strategy for communities by launching the alternative currency. We're trying to rush it, but it hasn't been that easy. But we are integrating the Seeds initiative within our Regenerate Costa Rica. So we hope in a few weeks to already have the first funding with Seeds out there to help create a better exchange mechanism for food producers and consumers without having to go through all the regular channels, which are controlled by corporations and taxes, value-added taxes, and a bunch of other restrictions that make it difficult to provide the necessary food for all the people. Let me see, I don't see anybody else. If anybody wants to ask something, just open your mic.
Edward, in the meantime, until others come in, if I could ask a question to all of you, what is it going to take to move your societies toward the adoption of blue-green economic systems and regeneration? Because we're at a moment now where there is a new opportunity for transformation. But if we wait too long, basically, if we had just by choice moved into the transformation to a blue-green economy 3 months ago, we would have had $30 trillion to assist in that transformation. Now we've lost between $5 trillion and $10 trillion already within the pandemic. And if it goes on for another year and a half, any of that capital that has been accumulated that could be used for the transition will be lost. Now, maybe there are scenarios in which that's a good thing, but I think it's going to be very difficult. It means that a lot of people potentially would die because we do not have the means to transition effectively. So how can we move quickly? How do we move our political systems? And we are seeing in the Caribbean something very promising, and in other places at the local and hyperlocal level. So are we seeing any efforts that are definitively moving forward in your countries that we should be considering as bellwethers of this kind of movement? And Costa Rica obviously is great as a society moving this idea, and as is New Zealand.
We actually have a joint effort, which you started last night, going forward with designing regenerative roadmaps for Costa Rica and New Zealand in parallel. And it has been very interesting because we have our framework based on the donut economics and on regenerative economics and on regenerative development. And New Zealand has a strong focus on local communities and bringing communities to work together. So it's going to be very interesting and complementary to find how we can actually strengthen local communities to really pop up. And if we do want to do a regenerative strategy for the COVID, we will have to work from the bottom up, bioregional, community-based systems. Just 2 months ago, we had people here protesting that we weren't bringing in avocado from Mexico because the national avocado was more expensive. And now at least we have national avocado because the farmers survived, because the government didn't release the imports of avocado, which would have killed the farmers. So we're starting to see a lot of big challenges into our traditional mindset that will open new channels for regeneration. And I think that's what we have to speed up, and that's what we're trying to do, speed it up. But it's actually not an easy process, and I'm not sure how successful we will be, but I don't think we have another chance. If we go back to business as usual with all the restrictions on environmental damage being lifted, we will rapidly get into a larger type of collapse. Is anybody wanting to give any final question, final remark? We have to go closing pretty soon. We're a little bit over time.
I've got one final question, not on the same topic. This is a different topic. To our friend, probably from the WHO. As a European, we're very aware Sweden has chosen a different model. Your model is on the kind of total lockdown model, and that flattens the curve. Can you tell me what's going on with Sweden? Is their alternative approach working, or are they going to be dying in the streets? Do you know anything about that?
Thomas, unfortunately, no. The answer is no. I am in the region of the Americas, and we study some specific cases in other regions. And the cases that we study more was Spain and Germany and because France, because of for us was important the way that they were managing the pandemics. In the Scandinavian countries, I maybe other colleagues or mine, but I didn't, so I cannot answer that question. But I can find out about the approach and give you some comments by email.
If you could, yeah, please.
Thomas, on Sweden, Sweden is taking more of a herd immunity approach. The thought is to allow sort of a more natural progression of the disease through the population. And also Denmark, Germany, there are other societies that are opening up more now within Europe, is my understanding, but in more selected ways. But China has a very interesting approach in their opening. They have much better intelligence of who actually has the virus and who does not, which is not just by confirming through lab tests. They're looking at hotspots and being able to see how people are connected to each other, which is probably something that we should do more broadly. And then they are opening up in areas where there is no evidence that there is a likely transmission. Very interesting circumstance in Sweden, and we are watching that carefully. We don't know what the outcome will be, but we do need to reach herd immunity either via vaccine or if we can in the meantime also through creating immunity within populations that are at very low risk. It will be interesting to see how that evolves.
Thank you.
Great. Well, we're 11 minutes past the official closing time. I hate cutting these things short, but I'm sure if we would leave it open, we'd go for another hour. If anybody wants to make a closing comment, then
well,
I'd like
for Thomas, because I'm just checking here very fast. From yesterday for today, they increased in 49% the number of cases. So they have 7,600 cases, and today they have 11,445. I don't know exactly what they are doing, but I will find out and I'll let you know. Over.
Thank you.
Just one comment to Thomas. Thomas, it is possible that synthetic biology, very likely actually, will play a role in the creation of the vaccine to address COVID-19. And you are correct that the genie's out of the bottle now, and synthetic biology can be used for nefarious purposes. But there is a letter from over 1,000 scientists that are saying that this is not a product of synthetic biology. Nature can actually be a pretty malicious entity when it feels it's necessary, I guess. I'm attributing intelligence to Gaia in my statement, but even without the kind of anthropomorphic view, nature can be quite destructive.
Okay, thank you. Yeah, I'd love details on that letter.
Yeah, I can provide that to you.
Well, thank you, Michael. Thank you, Enrique. And thank you all for having been with us. I think it was a very interesting session. I still feel like we didn't cover everything I wanted to cover in it.
Oh, Eduardo, I think you're losing connection there. Until you come back, what I want to say is I think that we have the opportunity now to look at how political systems are adopting the approaches that are more focused on resilience and regenerative agriculture, for example. The Caribbean, you should look at what CARICOM did yesterday, because we think we've had a big breakthrough in moving toward a more regenerative approach. Maybe Enrique, did you want to say something in closing? Because we may have lost Eduardo.
No, just keep safe, guys, and stay at home. You
my
have
internet
to.
fell out.
Well, thank you all. Looking forward to moving this forward. And what I want to see is if we can organize ourselves in a collective intelligence. Thanks, Edward. Back to you.
Yeah, I'll be in touch, Mike. Thank you.
Thanks.
Thank you so much.
Okay, thank you. Nice to meet you all.
Nice to meet you.
Bye, guys. Thank you so much. Thomas, I will send you the information.